All right, we're going to go over counterstrain points for the posterior articulations of the ribs from 1 through 6. Rib 1 is different than rib 2 and 6, 2 through 6. Rib 1, the positioning is to extend the patient, side bend them away and rotate them towards. So if I'm working on this side, I'm just going to put his arm up onto my knee to support his, just for the technique. I'm going to lean him back into me, just for his own postural muscle tone, so it's reduced. I'm going to find the tender point. So rib 1, find, you should know the way to find T1 if you're not sure it is, but it's also the one right below the prominence. So this is the articulation here. I'm going to ask the patient when I press on it if it is tender. Is this tender?
Very.
Okay, it's very tender. I'm going to set that as the patient's 10 on the scale. So that's your 10 now. And then I'm going to work on positioning the patient until there's a reduction in that pain of 70% or better. So to start with the positioning, I'm going to extend the head. I'm going to side bend the head away. I'm going to rotate it towards, and then I'm going to press on the point again, see if there's a reduction. Is there a reduction in pain?
Much better.
Much better, great. What would you rate it on the pain scale? From
2.
0? 2? Awesome. Okay, so now that I found that point, I'm going to leave the patient in this position for 90 seconds. 90 seconds later, I'm going to reassess the pain by pressing on the tender point. How does that feel?
Awesome.
So there's a great reduction in pain. At that point, I'm then going to return the patient to neutral. And the patient sit up, and then I'm going to take the point again and ask how that feels. Okay. For ribs 2 through 6, they're a little different. So I'm going to put the patient's arm up again. This time I'm going to use his arm as a lever for some of the technique. So with ribs 2 through 6, I'll find rib 2. This time I'm on the opposite side, but the arm's still there. So I find rib 2. Is that tender?
Yes.
Okay. So now with this one, I'm going to let the patient slump into me a lot because I'm trying to create flexion at that joint. I'm then going to side bend the patient away from that point. So side bending away from that point, I'm going to go like this, and that makes his body side bend this way, which is away from that point. I'm going to rotate the patient away from that point too, so I'm going to bring my body forward, and then I'm going to assess the patient's pain in that position by pressing on the counterstrain point. I'm going to also give him a little bit more flexion in the head, and then this is just to let his postural muscles relax. So I'm holding the head here, and then I'm going to assess the pain there. How does that feel?
Good.
Okay, is it less, is it 70% reduction in your pain?
Absolutely.
Okay, good. I'll hold this for 90 seconds. After 90 seconds, I'll reassess by pressing on the counterstrain point again. How does it feel?
Awesome.
Okay, and then from there, I'll bring his head back. I'll straighten back out, and then I'll put his arm down and relax. And that's it.